welcome, and thank you all so much for joining our webinar today on lessons from the NICU during COVID-19. We are recording this webinar, and we expect the recording to be available on our website within the next week or so. Everyone's on mute, but if you have questions, please use the Q&A tool. There is a comment section in the chat box that you can use to communicate with us, and we'll be checking that throughout the webinar. I also want to share that we have over 700 individuals that have registered for our fall webinar series from over 50 different countries. So we're just so grateful to the international community that's come together to join us for these. We are really honored to dedicate today's webinar to baby Amelia. She was born in March at the beginning of the pandemic, and she tragically died from necrotizing enterocolitis. Amelia's parents are joining us today, and they're going to be sharing Amelia's story in just a few minutes. And we're just really grateful for their courage and for their commitment to honoring Amelia in such an impactful and meaningful way. Go to the next slide. Before we continue on with the topic of this webinar, I do want to just take a moment to recognize and honor the memory of Dr. Ira Adams-Chapman. If you were on our last webinar, you'll recall that she presented on the long-term outcomes of NEC. A short time after our webinar together, she tragically passed away. She was a compassionate advocate, a really devoted, dedicated researcher, and I know she'll be deeply missed by all of us. If you're interested in learning more about Ira or would like to donate in her memory, you can check out her family foundation. It's chapmanfamilyfoundation.net. So I encourage you to consider that. I also want to mention that earlier this year, as the pandemic swept across the U.S., I received dozens of stories from NICU families who were being impacted and really restricted from accessing their baby in the NICU. Obviously, just at its baseline, having a baby in the NICU is so traumatic and stressful, and the pandemic has really made it soul crushing for a lot of families. So as more families shared their story with me and with the NEC Society, there was a team of us that came together, including Liz Rogers, who you'll hear from today, when we published this first opinion piece in Stat News. So if you'd like to check that out, I will share the link in the chat box in a moment. So I'm really excited to introduce you all to our speakers for today. I should introduce myself. I'm Jen, and I'm the founder and director of the NEC Society. I lost my son Micah to complications of the disease just before his first birthday. We're so honored, as I mentioned, to have Amelia's parents joining us, Felicia and Chris, who I said lost their daughter Amelia to NEC during the pandemic. We have Whitney here, whose son Elijah was born prematurely and spent weeks in the NICU during the pandemic. We're so honored to have Awanti here, whose daughter Indira was born prematurely and spent many weeks, months in the NICU during the pandemic. So excited to have Liz with us, who's a neonatologist at UC San Francisco, Diana, who's a neonatologist at the Children's Hospital of Philadelphia, and Susan, who's a neonatologist at the University of Colorado. So they'll be sharing their experience of what it's been like for them during this pandemic. We're really thrilled to have John, who's a neonatologist at Harvard, and he'll be facilitating our discussion and Q&A time together. And finally, we have Jonathan here. He serves as the NEC Society Strategic Advisor and will be our MC today, keeping us on track and on time. So thank you all for that. For anyone who is not as familiar with the NEC Society, I want to just do a quick introduction. We are a nonprofit organization that's dedicated to building a more just, equitable world without NEC by advancing research, advocacy, and education. I'm sorry about the dog barking. We bring together patient families, clinicians, and researchers, other diverse stakeholders who are really committed to improving outcomes for our most vulnerable babies. I will say, if you're on social media, I'd like to invite you to follow us. We're on Twitter, Facebook, Instagram, YouTube, LinkedIn, and we also have a blog that you could consider subscribing to on our website at necsociety.org. We're thrilled. For the last few years, we've done an in-person marathon every year in December, but this year, because of the pandemic, we're doing a virtual run walk December 12th and 13th. Registration is open. If you are interested, I will share that link in the chat box as well. And one other really exciting project that we have are just launching actually now is a prioritized research agenda around necrotizing colitis. And we'd love to hear from all of you about what questions and topics related to NEC that you think are should be on high priority. And we're going to explore how we can begin to address some of those questions. So I will share that link in the chat box in just a moment. I'm going to just do a quick disclosure before I hand it off to Felicia and Chris. We are not providing any medical advice today. Our speakers' views and our presentations today are independent from the NEC Society. So thank you all so much again for joining us. And I'm going to hand it over to Amelia's parents, Felicia and Chris.
All right. Thank you, Jennifer. So as we were just introduced, my name's Felicia Sears, and this is my husband, Chris. And so if you look at the screen, you will see pictures of us. And these people who were eagerly awaiting our daughter, Amelia, don't have masks on at the time, because this was probably days before actually everything started to shut down, and days before we actually welcomed our daughter as well. So on the left-hand side, you'll see a picture of me with about the biggest bump I was actually able to grow with her inside. And a picture of my husband as we had just been gifted a little pair of booties. And that would actually be 2 days before Amelia was born, and probably the last time we ever saw the inside of a restaurant as well. So 2 days after that picture was taken, our daughter, Amelia Quinn Sears, arrived very, very unexpectedly at 22 weeks and 6 days gestation. And so bit of a very chaotic day, obviously, but so grateful to all of the people, all of the wonderful people at Labor and Delivery and the neonatologist and the nurses and other NICU nurses who helped deliver our daughter and immediately resuscitate her and intubate her, so that we were able to see our little girl waving at us basically as she was about to be taken to the NICU for more care. A few days into our daughter's stay at the hospital where she was born, which is a level 3 NICU, she had quite a scare in the middle of the night with her glucose levels. And she needed at that point in time to be transferred to the local children's hospital, Riley, which is our level 4 NICU. And so she was lifelined. We had that very, very scary moment on the left-hand side, you see, when we're kind of following her lifeline, her little incubator out with the lifeline crew as they were getting ready to take her away. At this point in time, people still were not wearing masks because, again, like, we were truly at the beginning of the pandemic. There were no visitors allowed in, obviously, at that point in time. So delivery was just me and my husband, Chris. And I will say, actually, my in-laws were lucky enough to be able to see Amelia, but they were a very, very, very rare exception. We would later find out that was only made because there was some fear around Amelia passing before she actually was delivered. So on the right-hand side of this, you see, once we made it to Riley's Children's Hospital, the NIC view became our best friend and the best friend of so many people in our lives. Given all of the isolation of the pandemic and the fact that nobody had the chance to truly meet and get to know and love our daughter, the NICU was a camera that allowed everyone to see her. And so far and wide, that link was passed to all of our friends and family so they could get to know a little bit of her spirit. A few days into our stay, about a week into our stay, we got to see the most amazing thing. We watched our daughter open her eyes for the first time, which I can honestly say was, one thing you never think you'll get to see a human do, truly actually like struggle to open her eyes for the very first time. But we were able to see that. And this is one of those moments where, unfortunately, my husband captured this moment and I did not, because we were not there together at that point in time. So it was yet another one of those moments we had to experience separately and then try to share in the joy together when we were able to.
Yeah, really quick note, actually, as Felicia was saying, when we were transferred from IU Methodist to Riley's, that was really the last time that we were all together as a family, where we could actually spend time with Amelia and Felicia and I all together during the first part of her stay. So as we got to Riley, it was only her in the room or I in the room, and we, basically had kind of shift changes. Every kind of with the nurses, had their own shift changes. So that was our life from really probably the third day on until as you'll see here in a little bit. We had some amazing memories at Riley, and amazing nurses, amazing care team, and we got to do some really cool activities with Amelia as she grew and got bigger and stronger. And about a week into her stay at Riley's, that was when we got those first signs of neck in general, where she had some issues with her bowels, and doctors did some tests, and we had that big first scare where we didn't know if there was a perforation or not, and that really kind of kicked off our whole journey with neck at that time, of understanding what it was and what she was going through. And really after that first episode, about a weekend, it really kind of defined the rest of our stay throughout our time at Riley's. But we did have some good times, as you can see on these photos. As after that first initial scare with her neck, we spent the next 10 days or so really gearing up for the first big ostomy. We were hoping it wouldn't have to happen, but as she got bigger and stronger, the surgery team felt she was ready to take that on, and she did amazing through it, and really was a champ. And we were just it was so inspiring to watch her courage and strength, and she was amazing. Ultimately, she had a little bit additional complications from her first surgery that the surgery team checked one day, and kind of out of nowhere, weren't exactly sure if what was going on. They thought she may have just a kinked intestine or something along those lines, because the air bubble was kind of coming back. And the ostomy wasn't, they were worried about the ostomy from the original surgery. So when that happened, they had to do an emergency second ostomy that was really unexpected, and they didn't even really expect it themselves. And unfortunately, after the complications from that second ostomy, that was when we spent the next handful of days really fighting that battle. And Amelia, gave it her all, but unfortunately wasn't able to make it through that. But at the end of the day, we were able to spend the last handful of days together for the first time, and that was pretty powerful. So here's just some fun photos from that last few days together. And then finally, just some lessons learned. So it's a marathon, and I think we heard that a million times from our nurses, and they were right. And it really is a marathon. You have to really, have that approach and that mindset every single day in the NICU. Another big area that Felicia and I really focused in on was, to always say thank you to our care team. They were amazing. Excuse me. They were amazing, and did everything they could for our daughter, and we wanted to do everything we could for them. From the coronavirus impact, the impact of that NICU camera was really a game changer for us, because we were able to still stay connected with our daughter and each other while we were doing our shift changes and isolated by ourselves in the room together. So, that really gave us a lot of peace of mind, and it gave our family the ability to check in and to be a part of the process. Don't do it alone. Obviously that's kind of self-explanatory, but it's a hard journey, and Felicia and I had to really be there for each other and help each other through this, and to do everything we could to support each other as well. And the final lesson was, kind of control what you can control. There's not a whole lot you can do as a parent in the NICU, but these other lessons on here are examples of areas where you can control what you can control, and just try to keep your mindset right, and know this is a marathon, and you're gonna get home. So that's all of her lessons here. Anything else you want to add?
Nope. And that's our Amelia's story.
Chris and Felicia, I'm so sorry for your loss, but so appreciative of your willingness to share your story with all of us and help ground us and remind us how critical this work really is. So thank you both very, very much. I want to transition to Whitney, who can share her story and sort of what her experience was like. So Whitney, I'll turn the floor over to you and let you take it. Whitney, you're still on mute. If you can pull yourself off mute for it.
Okay, can you hear me?
Yep, that's great. Thanks.
Okay. Can you still see my screen?
Yep, you're good to go.
Okay, so I was saying this is a picture of me way back in the day, but I like to start here because it shows a bit of what I was going into with at least this pregnancy. And so this is how I saw this, I was calling it our last baby, our fourth baby, Elijah. And I went in just like this. I'd had two before him. I'd had two successful, you can call it that, home births. And really just ended up here and didn't know how. I was confused. Kind of had all of my ducks in the row. I think the fortunate thing is that I had a midwife who I could text regularly, who immediately caught the fact that I was going into labor early. And so, you know, going from what I've been used to, at least in my last two births, to seeing my 25-weeker Elijah like this, it put me into a very different ball game. And I am someone, I have to give a little bit of context, who knows quite a bit of the work and the disparities. And so I felt like, oh no, I'm in the system, I'm a statistic. And so I began to really think about what is inherent about me and birth, and what do I believe in this moment? How did I end up here? And how do I win at this NICU life? I like to start with this one too, is because I think this was my first win. I wasn't actually going to be able to hold Elijah on this day. And I just remember kind of this back and forth with these new people that I was meeting, these new providers. And it was also the very top of COVID. And I like to show this too. He was born on February 26th. So this is what COVID meant to me at the very beginning. I remember just seeing this, like people covering these things in bags, but I had no idea that it was also going to separate me from my family. So I went straight into mommy mode, pumping, nonstop. That first week, I was actually able to go in with my husband. We also have 3 other kids, but shortly after that, I had to be the only one. And so it was very lonely. I think that if I could have had, you know, a savior like Black Panther, I would have definitely called in for help. Sorry, that's my little one also. But I felt very much like this, isolated in this place of I have to fight and advocate in a space that I'm not used to. And so I quickly began to do 2 things: learn to love the people who are helping me, and I built a team. And I say built a team, meaning I gravitated towards certain nurses especially, but I also used this curtain a lot. That's why I put 2 pictures. Anytime that I felt that I wasn't being listened to, especially when it came to breastfeeding Elijah, I would pull that curtain and I would do exactly what I felt like I needed to do in that moment to do those little wins. And for me, it was the lick and learn. When someone said, oh, lick and learn, oh, he's too early, but I saw him rooting. Oh, I'm just going to test it out. Things like that. And the hospital was still, and I delivered at Duke, the hospital was still trying to figure out all of COVID. So on top of, there was days I would come in and be able to say who I am with a mask. And there were other days I had to have my temperature checked. So it just felt like there was always this kind of continuous change. Even with Elijah, right now you can see in this picture with his cannula out, it was this constant, you know, all of these changing factors around me. And does this child need this? And how do I know? And he's not breathing with it right now. I pulled the curtain and what do I figure out? And this is basically me, breastfeeding all the time in the NICU with my head off, feeling very separated and detached from what I felt like I could do. But we had those major wins again at breastfeeding, that we did make it to the point of the graduation day. But I don't say this lightly that Elijah left the NICU breastfeeding, because I know, again, the disparities around that. But I fought, and pulled my little curtain when people said no, and when my baby was doing something different. And I like to use this because, I mean, the Soul Train, right? But because this is how I left. I walked out of the NICU doing this or something close to it. Again, it was very hard, 102 days. But what I was able to take with me, not just my baby, was an advocacy for other people. And this, although all of that dancing, this is like my real life right now, all the time. But I do have this baby that I fought for breastfeeding, that I feel significantly improved our experience and his outcomes. And so I'm very fortunate to be able to say that Elijah is continuing to breastfeed, is continuing to do this. And so the lessons, I think I've already mentioned it, is number one, again, building that team, having those especially the nurses around you, knowing what you want. I talked about breastfeeding a lot from the day he arrived at 25 weeks. Number two is recognizing signs and things in your baby that you feel, I think they are being ignored, but I'm going to bring this up constant. And number three, that curtain. I mean, that I will pull that curtain around when when it just felt, again, like, I don't think they're hearing me. I don't think they're seeing what I'm saying, but I know what this baby is doing because I wanted to be also a stakeholder, right, in his care. I wanted to partner with you in his care. And if I wasn't feeling like that was happening to me, I felt that I did have this moment in time where I can see for myself, just like they were saying. But I am really glad that I'm able to share this story. And I hope that you all enjoyed it. Thank you.
Whitney, thank you so much for sharing your story. And it's great to see Elijah doing so well, and hoping you've got a lot of years of Soul Train dancing ahead of you guys. I want to turn it over to Awanti to share another experience from a family here to tell their story about Indira. So Awanti, I'll turn it over to you.
All right. Okay. Hi, everyone. I'm Avanti. Yeah, thank you so much for giving me this opportunity to share our birth story for baby Indira. So Indira was born on March 5th, again, before the pandemic hit, in Michigan at the C.S. Mott Children's Hospital, which is, like, again, a level 4 NICU, and it's one of the best hospitals for pediatrics and neonatology here. She had to be born early because I had severe preeclampsia, and she was born at 28 weeks and 5 days. And back then, there were no restrictions to any visitors. In fact, even extended family could come. And so much so we were even given the NICU tour a few days before delivery. And these are just her first pictures. She was barely 2 pounds. So over the next few weeks, we really came to terms with NICU life. And I mean, the cases of COVID also slowly started increasing in Michigan. And so the hospital changed its policy to only allow parents, no external family or like relatives. And we were fine with that. We did a lot of kangaroo care, and we were just getting used to all the machines. It was so overwhelming in just coming to terms with the fact that you have a premature baby and learning everything and attending rounds with the doctors. But we were more or less okay because we were together. And then on March 24th, our governor gave her first stay-at-home orders because the COVID cases were rising really rapidly. And then Michigan Medicine changed its policy again, and they said you can have only one parent. However, parents could still take shifts at that time. And this was a little tough for us, but we were still trying to wrap our hands around it. I mean, we understood obviously the gravity of the situation. But soon, within that same week, they changed their policy again. And they said that you could only have one designated parent throughout the hospital stay. And since I was pumping and, breastfeed, just doing a lot of kangaroo care to promote my milk production, of course, I decided to be the designated parent stay. But initially, we thought that this would only last for the first stay-at-home order, which was just for 14 days. But that stay-at-home order went on getting extended as of course, Michigan tried to control its cases. So there was no certainty to when this date would end and when this one-parent policy would end. And over the course of time, we met all her milestones alone. My husband couldn't come. We didn't even have the NICU camera. We had to, of course, when I was there, I would do video calling with him. It was really hard. I know, as all NICU parents know, you really look forward to small individual milestones, the first time your baby is off oxygen support, or the first time the incubator is off, or even her first month birthday, as you say. And all of these milestones I met alone. In fact, even Mother's Day, I was alone. And we tried our best to be positive. We really tried different coping strategies. I did a lot of journaling. As you can see, my husband took to painting at home, just painting little things, the small Wonder Woman here, just to try and make his presence felt here. But all of this took a massive, massive toll on mental health, and for which we're still recovering from that trauma of just that forced separation. And I think over the time, we faced a lot of cost of this one-parent policy, and I just want to talk a little bit about this more, especially for first-time parents, for any parents, but especially for first-time parents, just handling this alone just leads to increased trauma. And moreover, the mother and child should essentially be considered one unit. I had a major surgery, and I'm sure most mothers here who have to deliver so early, probably via C-section, you really need your partner's support. I couldn't even walk for the first week, without him being able to hold me. And I was seeing new parents come in, just from the labor and delivery, and being told that your partner cannot wheel you in. And the tears and the trauma, I just can't forget that. And moreover, it just didn't make sense to us because we were living together. So even if you're allowing even he was dropping me to the hospital, picking me up. So we are exposed to each other. And I didn't understand why they wouldn't allow us to take shifts, because restricting one parent is not really, you're not reducing your risk of exposure. If I have COVID, he has COVID, or if he has it, I have it. So it didn't make any sense. And this policy essentially put a lot of disproportionate burden on mothers, especially if you're breastfeeding and pumping and, without any support. And moreover, dads also need to bond. Now, NICU parents will tell you, we don't have the normal experience of parenthood, getting to hold your child when they're born or being there. You still feel like a visitor because you're seeing your baby in the incubator. So you really have to try your best to bond with your child, to see your child grow. And when you're separated from that, you're essentially cutting off that bonding. And one thing is, parents are really not visitors. They're really a part of the child's care team. So I constantly, my husband and I both, we constantly advocated. We spoke to anybody who would listen in the hospital, the social workers, to parental advisory committees. And eventually, everybody empathized, but they said nothing could be done. So eventually I wrote to the hospital COO, just took a short and, explaining and requesting an ease of visitor policy. And I think all of that advocacy worked because the CEO replied, and then they made exceptions for us. We could still take weekly shifts. So here in this picture is my husband seeing her after 3 weeks of separation. And I think in the same week, they kind of realized that this is they eventually extended it to all long-staying parents. You could still take weekly shifts. And in the last week of discharge, in the first week of May, actually, after March 24th, this was the first time 3 of us were together for discharge training. And on May 16th, after 73 long grueling days in the NICU, we were discharged. So just some takeaways from our experience, I think, is that we kept advocating that, and I will say this to anybody who would listen, is that parents are really not visitors. They are an essential part of the baby's care team. And even our NICU, thankfully, really promoted kangaroo care. I know, some of my other friends who were in different states, because of the pandemic, they weren't allowing skin-to-skin contact, but I think that is so essential. And I really hope that any policy changes made, of course, even the hospital was facing this for the first time. Everybody was facing this for the first time. They were all trying to be very careful, and I don't blame them, like, for trying to take these policies. But I do hope that at least for NICU and pediatric care, policy changes should be made in consultation with, families and parent advisory committees. And while we were there, we actually witnessed 5 policy changes, like back to back to back to back. The minute you try to get used to one policy, it changes. And this is on top of just dealing with the fact that you have a preterm baby, you're seeing your child struggle, or or your own health as mothers, recovery. It was all very traumatizing. So, but one key takeaway I took is that your voice as parents really matters. You are your baby's biggest advocate. And I do want to say that in June, Michigan Medicine eventually, like after a lot of advocacy, I do want to think I played a part in it, like my husband and I, as well as other parents, when we spoke. Michigan Medicine changed its policy to allow 2 primary caregivers for NICU and pediatric patients. And even now, like as the COVID cases have resurged in Michigan, and we've had a new stay-at-home orders this week, Michigan Medicine has like restricted visitors for adult patients, but their pediatric policy remains the same. Like they're still allowing 2 parents. And I'm very happy that they listen to that. And I do hope other hospitals also take away. Having said that, we did have like incredible support at the NICU itself. Like, of course, we are indebted to Mott for saving Indira's life, but beyond that, they really had, our NICU had parent hosts who are actually former NICU parents who are there to give peer support, because they've been through that, they guide you through, walk you through all your milestones. And in the absence of any social interaction, they were our, friends there. And of course, nurses, and everybody else, other parents have also said so, like we could also have a primary nurse team where you could choose specific nurses you like, they remained her nurses throughout. And the excellent medical team, the doctors, they were really open to us asking questions. And I would also say, if you're a NICU parent, don't hesitate. Your questions are not stupid, even ask away. We also had NICU therapists, and a lot of lactation support had excessive pumping, and again, needed a lot of help with breastfeeding, latching as well. So after all of this, yes, Indira was discharged, and now she's happy and growing. And yeah, I guess just the takeaway of that is families should not really be separated, because it's really, even in the worst case scenario of a pandemic, because it helps them, it helps us. And as you can see, like babies are happiest when they're with family. Thank you.
Oh, Auntie, thank you so much for sharing your story and Indira's story. It's impossible not to beam ear to ear with this photo of Indira, so thank you for sharing it. And I think you're bringing up you can go ahead and pull your screen share down. It's a great transition, and as you're hammering home how critical it is to advocate and make very clear what you need and what you're seeing. A really great transition to bring in Liz and Susan and Diana, three people who are actually on the clinician side of this and getting to see this and helping execute a lot of these policies and shape what that experience is. Before I hand it over to the 3 of them, I want to just highlight for everybody, in about 20 minutes, we're going to open up for a Q&A. There's an icon at the bottom of your screen where you can submit questions. So feel free to use that to get questions for either any of the panelists or overall for the conversation, and look forward to doing that. But first, let's hear from Diana and Susan and Liz.
Thanks so much. We are so grateful to be here today to first bear witness to our families' experiences, hearing both your traumas and your victories, as well as to offer some insight into how COVID has impacted the inner workings of the NICU and those of us who work there. And the 3 of us acknowledge that we are 3 neonatologists, and we're doing our best to represent our multidisciplinary teams. But certainly our nurses, our environmental specialists, our social workers can all say that the impact of this pandemic has been different. So we're doing our best and acknowledge our teams there. We want all our patients, families, coworkers to know us like the smiling faces you see on our videos. But unfortunately, for the last 10 months, our patients and our coworkers see us like you see us in this photo. So we want to take some time to take off these metaphoric masks and face shields to share some data, more stories, and look forward to engaging with questions with you all at the end. So I'm Liz Rogers, and I'm a neonatologist at the University of California, San Francisco.
I'm Susan Huang. I'm a neonatologist at the Children's Hospital of Colorado.
And I'm Diana Montoya-Williams. I'm a neonatologist at Children's Hospital of Philadelphia and the Hospital for the University of Pennsylvania. So, you know, I think one of the things that the families that have spoken before us have really nicely laid out is that hospitals have had a wide range of policies when it comes to who can be with mothers during deliveries and who can visit infants in the NICU. And we wanted to just spend a few minutes outlining the current policies in place at the institutions that we work out. But what I think has already been made more clear than we could ever do is that these policies have evolved a lot over time, often, and often all of us who sit in the NICU are learning at the same time what the evolution of the policies are. And so the decisions about policies have occurred at various levels. And so it can be very challenging, as you've heard, for families, of course, but even for physicians to follow what it is that the rules are for at any given time. So for instance, in that first column, you'll see the two hospitals that I work at. And at HUP, or the delivery hospital that I work at, one support person has been allowed at delivery. That has been the policy throughout. And there's always been restrictions on leaving and coming back, such that support persons who leave have to wait till the next day to be able to come back. And those restrictions have evolved, and that's been pretty difficult. Versus in the NICU, I work in two different NICUs at both of those hospitals, and those policies, even within, you know, a same physician team working at two different hospitals, are different. So one of the hospitals allows one caregiver at bedside to this day, whereas the other allows two. One hospital specifies parents, the other only specifies caregivers. So a lot of diversity there. Susan, do you want to talk about Colorado?
Sure. So I too covered two hospitals. Our delivery hospital is called the University of Colorado Hospital. And for birthing individuals at this hospital, they are permitted to have one support person at delivery. And after delivery, their support person can be present. However, once they leave on a given day, they're not allowed back until the following day. So there are strict rules in place. Now, in terms of neonatal care, at the Children's Hospital, when the pandemic first started, it was only one parent at the bedside. And more recently, that has changed. And so now two caregivers can be there at the same time. And in the event that there is another family member, such as a grandparent, that would like to visit, one parent and that other family member are allowed to be at the bedside. At the University Hospital or delivery hospital, both parents are allowed at the bedside now, whereas early on, again, it was just one parent that was permitted.
And at University of California, San Francisco, we similarly have had one support person allowed at delivery. And then throughout the pandemic, we've allowed for two identified caregivers total for the hospitalization. So a little different than what Awanti was describing, but only one at a time. And initially that was one for every 24-hour period. Then it evolved and we started allowing 12-hour shifts to come in, just like our nurses. And just most recently, we are allowing for a 30-minute sort of handoff time between caregivers so that there are 30 minutes where both parents can be there during the day. But despite considerable advocacy at the city, county, and even state level, the policies that have sort of kept us in place have unfortunately not allowed more than one parent consistently at a time at the bedside.
So there's so much that we can say about the impact of COVID to life in the NICU. And so to organize our thoughts, we thought we would spend a few minutes sharing some of our perspectives and some of our experiences that we have witnessed about the impact that we have seen on parents, although I think the stories you have heard do these impacts far more justice. Some of our experiences as providers during this pandemic, and then some of the ideas and thoughts that we had in terms of how we feel that COVID has impacted even our patients directly. And you can read those bullet points there. But we thought we'd share some of our stories and experiences as you read through that slide. And so to start, I just wanted to tell you about an experience that continues to come to mind often for me these days, about how I really witnessed and have continued to worry about the impact of COVID on our NICU families and parents. And this was really early in the pandemic. I was taking care of a baby who was born with what ended up being a condition that was incompatible with life. And it was a very hard situation that was made all the more complicated by the fact that the diagnosis was really uncertain for the first few weeks. And it's really hard for me to this day to convey how much I struggled with the fact that I could not fully connect in the same way with parents that I usually do when I'm helping them navigate through end of life decisions. I couldn't see their entire faces to gauge their emotions, and they couldn't see mine. I couldn't reach out and, touch their shoulder or their arm when both of our hearts were breaking during a specific time point. And specifically to this case, and I think why I come back to it so much, and maybe because we're both moms, what seemed to break both my mom's and my heart the most is that in this particular case, the patient's parents had an older child, and mother really struggled with not being able to bring the baby's older sister to meet him at least once before he died. And I remember having many conversations about that and hearing her talk about how much this was keeping her up at night and how much she had cried about that. And I'll never forget seeing that pain layered on pain. And that was really pandemic created. Her concern for her dying baby and her concern for the impact on her 4-year-old daughter. And it really made me very worried about the long-term impact that this is going to have on the parents who experience pain and bereavement in the NICU. We already know, and there's already data, that it can be a very traumatic event just to have a baby in the NICU, much less a baby who passes in the NICU. So I really worry about what we are going to learn in the coming years about the impact of COVID on rates of depression, anxiety, and post-traumatic stress disorder among our NICU families.
And I can move on to share my experience as a provider during this pandemic. And so I wanted to share my personal story with you all just as one example of the COVID-related struggles that providers are facing. And while these experiences may not occur in the NICU, they certainly impact the mental, emotional, and physical bandwidth we bring to clinical care. My parents' older brother and I were first-generation Korean-American immigrants. And while my brother and I have adopted nearly all aspects of the American culture, my parents continued to reside in a predominantly Korean community in New Jersey, shopping at Korean stores and speaking in their native language nearly all the time. And as New York and New Jersey were starting to recover from the horrible tragedy of COVID illness and death this past spring, I called my parents, as I do every week, to see how they were doing. And in a very matter-of-fact way, my mother said that my father had just had 12 centimeters of his colon removed the day prior and was still hospitalized with an uncertain discharge date. Now, while my father doesn't have the healthiest lifestyle habits, being a lifelong pack-a-day smoker and moderate to heavy drinker, he was in pretty good health without any major chronic conditions. So I was shocked to hear this from my mother. And when I kept asking why he had the surgery, she couldn't give me a clear reason. So I called my father, who was recovering in the hospital, and he too could not tell me why he had this major surgery. And while I was grateful that there were no major complications with anesthesia or the surgical procedure, I was in a near panic about what was happening. Now, I should share that among Koreans and Korean Americans of my parents' generation, the doctor's word might as well be the word of God. There's a tremendous amount of respect given to physicians, and their recommendations are rarely questioned. While I could have assumed that the reasons for this surgery were legitimate, I needed answers. So that afternoon, I got COVID tested, literally an hour after I got off the phone with my mother and father. And I had not visited my parents since last year for fear that I was an asymptomatic COVID carrier, and knew that I needed to get tested for some peace of mind. And when the test returned negative the following morning, I flew out to New York, New Jersey, rented a car and rushed to the hospital. The airport and the flight were incredibly anxiety-provoking for me. I refused to eat or drink during the entire travel time and sat nearly motionless in the plane with my N95 mask on for the entire 4.5-hour flight and all throughout the car rental process. Only after I had sanitized the interior of the rental car and was finally alone in the car did I take off my mask. I did reach the hospital, and after an extensive discussion with his surgeon, finally understood why the surgery was indicated. I stayed with my father that day, and fortunately, he was discharged the next day. I was able to bring him home before returning to the airport for my trip back to Denver. For this return, I was yet again very nervous that I was now bringing the virus back to my own husband and 2 young children. Moreover, I was scheduled for clinical care in the NICU later that week. I knew that COVID testing was not a 100% guarantee of negativity, but again, I needed some peace of mind. So I was tested again, and again, it was negative. I also asked for antibody testing, and this too was negative. And I'll be honest, I do cringe at my confession of this extensive testing, given that the moderator for our session is John Zapanzik, who advises neonatologists to choose wisely, considering costs and benefits of tests and therapies. I share this personal story really just as one example of one provider's struggle during this pandemic, but also to highlight how our immigrant and non-English speaking families may struggle to navigate the healthcare system. And I fear that these barriers may be worsening during these uncertain times.
Thank you so much, Susan, for your courage to share that. And Diana, heartbreaking to hear. And I think we've all experienced, particularly at the end of life, some of the things that you're describing. And at UCSF, our Benioff Children's Hospital, we were recognizing the stress that was put on our providers. And I think we all are very clear that taking care of ourselves, whether it's as a clinician or as a mother or a parent, allows us to take care of our patients and our children better. And yet it is very hard for us. We center our patients as we think it is the right thing to do. And yet there's increasing data that rates of burnout, for example, really impact patient safety. So it's important to take care of our workforce. So we embarked on a Caring for Our Community survey at UCSF, and what we learned after surveying over 450 of our community members across the board, all disciplines, was really striking. We saw about 44% of our community was endorsing clinical signs and symptoms of anxiety, and over a third endorsing clinical signs of depression. So recognizing that is the context in which we are trying to provide the best care we can to our tiniest and most critically ill patients, I think is really, really powerful. And it speaks to how we as a community, as we're taking care, we really need to take care of ourselves and each other. We also recognize the impact certainly on our patients. And one of the things that was so beautiful to see in all your pictures, and Felicia and Chris, Awanti, Whitney, all of you, the skin to skin care. But we worry that developmental intervention, one of the most evidence-based interventions in neonatology, was somehow not allowed for many patients across our country during this time. And we still don't understand, and we won't unless we measure it, and therefore we must make a commitment to do so, the impact of the environment on our patients' development. The face masks, the lack of appropriate language stimulation, all of those environmental changes that we've had to make for safety. We don't understand what that's doing to the developing brain yet. Susan or Diana, any other points you want to bring up on any of these impacts?
I think the only other point that I personally wanted to make is how, and it's an impact that I think is shared across parents and providers, is really the impact on working parents during this time. I think one of the things that I've had to come to terms with during this pandemic is how tenuous my so-called work-life balance had actually been before the pandemic, and how much that has been challenged during the pandemic, and the impact of that on not just burnout and stress, but also work satisfaction and fulfillment and ability to find joy in the things that I had previously been able to do and work with. And so, for instance, my story really is one that I'm sure is shared by many, and it's harder for others. My husband is also a physician, and we had really relied very heavily on our network of grandparents to help us with childcare and like childcare coverage whenever the Tetris game of childcare left both of us at the hospital after daycare hours. And so at the time of the pandemic, when everything shut down, we lost daycare and we lost access to that network of grandparents because it felt very unsafe to be around them as healthcare providers and as the parents of young children. And so it was a very tough time to rearrange and adapt to that new balance. And when daycare opened back up for us, and we made the decision, which was a very difficult decision, to send our kids back to daycare, because I personally felt like I was watching my career disintegrate. It only took one daycare cold to really send our family back into havoc for another week. And I tell this story because I know that there has been so many working parents for whom childcare has been one of the greatest stressors during this pandemic, in addition to all of the other stressors of the pandemic. And I also recognize I'm very privileged that this has been one of the sources of stress, but I just want to bear witness to that, because I don't think that just affects working mothers in the NICU. I think that affects working mothers in every profession, including some of our parents who've had to manage that, in addition to the stress and anxiety and uncertainty of having their baby in the NICU during this time.
I think the last piece I wanted to just mention, and we've alluded to it as well, is many of our parents for whom English is not their first language, and our ways of communicating. We're all so used to Zoom now, muting and coming off video, and our ways of communicating had to completely shift. And for our parents who don't speak English as a first language, it is such a barrier. I reflect upon using sort of a video interpreter and a parent on a video and one parent in the room, and trying to have just impossible conversations, just an added barrier to developing the relationship that we want to develop with our parents. Susan.
I wanted to add that I think what's so troubling to me, and I'm sure to many others, is the isolation that not only parents in the NICU, but providers and many of our extended family members are feeling right now. And it's only during this pandemic have I realized how much of our quality of life comes from things that are outside of our home. And without that, we are not refilling our bucket in order for us to be giving to, be it our baby in the NICU or to our children in the home or to those that are nearest and dearest to us. And for providers, being able to be replenished to then return to work and provide the best and most compassionate clinical care that we can. And so I think everyone has their own way of really releasing their stress, finding activities that bring them joy, and not being able to engage in those things, I think has really certainly forced me to think about where else do I find that in order to fill my bucket so that I can then give back to my own family and then to the babies and families in the NICU.
And I'll say, I'm sure I speak at least on behalf of most of us. It's heartbreaking to hear, and yet so beautifully tragic, I would say, to hear Amelia say one of her lessons was always say thank you to your team, like that people are thinking about us. And this last picture here is actually on a parent's on one of the screens in our NICU, that below their own baby's care cycle, they put up a thank you for us. And I think that's it's just so meaningful to us to know that. And yet it makes us feel guilty because we want to be taking care of you. And I love what Whitney said about she sort of had to learn to love the people helping her. And we love that because we consider all our patients sort of part of our NICU family.
And so I'll close this out with this lovely, lovely writing from Liz's daughter. And I think it perfectly captures resilience, empathy, compassion, adaptability. We hope that the stories that we've shared with you all have provided some insight into the experience of patients, families, and providers during this pandemic, And while much of our time was spent on describing hardships and struggles, we wanted to end at least this provider segment with highlighting the resilience and adaptability we see demonstrated every day in our NICUs, in our homes, and in our communities. NICUs have had to change COVID-related policies and protocols repeatedly as we gain more knowledge about this virus, and our babies and families continue to accept and adapt to this constant change. And for providers, despite the turmoil in our own homes with online learning for our children, social isolation from extended family and friends, and fear that we're bringing back the virus from hospital to home, we all continue to show up to work to take care of newborns and their families. And incredibly, but not surprisingly, our NICU families continue to find creative ways to remain engaged and be at the center of their infants' health and development. So we appreciate your listening and your participation.
Liz and Susan and Diana, thank you all so much. It's really wonderful to have the curtain pulled back on just how much harder your jobs have gotten in all of this. And I'm buoyed by how effectively you're able to still lead with empathy and compassion in these really difficult times. So thank you for sharing your experiences. I'd like to invite the rest of our panelists to go ahead and turn your cameras back on. And I'd like to introduce and turn the floor over to John, who's going to walk us through a Q&A and get a conversation going with everybody. So John, I'll leave it with you.
Great, thanks, Jonathan. And let me start just by saying thank you to all of our panelists. 6 incredibly powerful perspectives about Amelia and Elijah and Indira, but also about how the providers are trying to continue to provide care to babies like them and their families during an almost unfathomably difficult period. It's really incredibly impressive. I think we'd love to hear from folks in the audience as well. We've asked for questions, but we'd also love to hear any of your experiences that you think it would be good for all of our panelists to comment on. So please feel free to start typing those into the Q&A, and we'll get folks to comment on them.
I was going to ask a question, if that's okay. Liz, you mentioned the need to measure and do research on the effects of the environmental changes that have taken place and that continue to happen and how that's affecting our babies. Do you know if those studies have started and who's leading it or how they're being done or any details about that?
Yeah, well, I think there's 2 things to mention there. There are certainly a number of active birth cohorts that are studying the impact of COVID on pregnancy and on newborn outcomes. And then there are other studies that are trying to really measure the impact of COVID on the NICU despite COVID illness. Certainly in California, through the California Perinatal Quality Care Collaborative, we're launching a parent survey looking at parent experience both in the NICU and as part of the transition to home, and trying to obtain some developmental support services sort of in these months after discharge, which we know has been very difficult for families. And that work is led by Susan Hintz and others in the CPQCC. But I know that the AAP is also looking at this. And I think in neonatology, we do feel that it's our mandate to follow long-term outcomes to understand the impact of our care. And so embedded within that is a strong commitment to measuring neurodevelopment. And it's a matter of sort of making sure that we come together to describe that and get results out to folks.
We do have a question here from Jonas Rasted, and I think it's important in putting the context on the reaction of the NICUs to the pandemic. The question is, what is the risk and potential consequences of COVID-19 infection in the NICU cared infant? Can one of the clinicians kind of summarize what we know? Diana, you're nodding. Would you like to take?
Sure, I can tell you a little bit about what I know and where I think the science is, but I'm happy for my colleagues to chime in. And I'll start by saying that there is not a lot of data on this for a couple of reasons. First of all, and somewhat happily, is that we are not seeing a lot of vertical transmission of COVID. And so what that means is infection in the baby if a mother is infected with COVID and having that transmission happen vertically in that way. We're not seeing that that's happening at high rates. And we have not seen a lot of infants or neonates become positive after their birth that we can identify from an exposure within the NICU. And so all of that leads to a very small sample of COVID positive infants at this time, from what I'm aware of, sort of epidemiologically in terms of the population. And so we don't really have the numbers at this point to know what exactly is an expected clinical trajectory for a baby who is either born infected or becomes infected shortly after birth. We just don't have the data for that, which in a way is good because we haven't seen a lot of that. But I think the other part of it is for the babies who do test positive is being able to follow them over time and start to tease out what is related to whatever landed the baby in the NICU, whether that's prematurity or something else versus related to COVID. And again, we haven't had enough sort of time, but also numbers to be able to answer that question. So that's a long story to say that there doesn't seem to be any clear indication of identifiable consequences to COVID for neonates. And I'll let my colleagues chime in.
Jen, did you have a comment? We're not hearing you, Jen.
Sorry, I'm working off my phone. I was just mentioning that my comment's not related to this though, so I wanted to give a chance to Liz or Susan or anyone else that wanted to follow up Diana before I switch topics.
Suzanne?
I just wanted to echo Diana's comments that there is a lack of data, and I think much of what we're starting to hear are anecdotal stories, all of our personal experiences in providing clinical care and having that NICU infant who becomes COVID positive later on in their birth hospitalization. And so I think we're starting to see some case reports, and I would say my own personal experience. I think all the various risk factors that you think of for having worse outcomes after an acute event, I think still holds, where in the instances that we've had premature infants who've been in the NICU for some time, then get COVID, have quite a rocky course, as they would say if they had RSV or some other viral process. That being said, I think we don't know about the other sort of multi-system inflammatory impact that COVID could have in our premature population.
And I just wanted to add one perspective, and that is, although the initial report said maybe we were going to cure preterm birth with COVID, unfortunately, as more data has come out, it appears that the rates of preterm birth have actually not gone down. And in a COVID positive population, they've certainly gone up as we try to manage critical illness, critical respiratory failure in moms. We're seeing more preterm delivery. And for an inequitable disease, which we can say for both preterm birth and for COVID, there's sort of a double impact on our communities of color in terms of the risk of preterm birth due to COVID.
Mm-hmm. I definitely want to come back to that last comment you made, because I think that's really important. Before I do, I want to extend this conversation to the families. Chris and Felicia, I was taken by the last bullet point that you had on your slide, control what you can control. And early on in the pandemic, we had started to get signals that probably babies were not particularly susceptible to the effects of this condition. So I guess the question for the parents is whether what risk do we have to get down to, and what are we willing to do to drive a risk to zero from low? Knowing that we didn't really understand the disease very well, did you find that those restrictions were overdoing it, or did you find that they were just cautious? What's your perspective on our kind of notorious conservatism and risk aversion that we have in the field?
Yeah, that's a great question, and it's a really tough question to answer, because I guess at the end of the day, we don't really know at all whether the decisions that were made were good or bad, and we'll never really know that. But I can tell you from an impact on our family, knowing that we never, from the day that she was born until, the last handful of days when we were in a really, tenuous situation overall, Felicia and I only saw each other in passing for, 5 minutes in the hallway while we were doing a change shift, and being by yourself and going through this whole entire process, it can be overwhelming, especially, given that outcomes can be, bad outcomes as well, so the knowing that your family's not there, that your spouse isn't there, and really kind of doing this on your own, I feel, really took away from a lot of the experience of the NICU, that we don't really ever know what that actually is really like. I mean, we used to hear from nurses all the time about, yeah, there's families that they would talk about how quiet it is up here, and how normally it's bustling with people in and out of there, and in a weird way that was kind of good for us, because you could be a little meditative almost, you could be really reflective, and we spent a lot of time writing and reading and talking to our nurses and talking about care and understanding more what Amelia was going through. So from that regard, it was kind of good, but just from our situation personally, I mean, it was pretty trying. We were just running back and forth in the hospital for 40 days.
And I think the only thing that I'll add is just that ultimately for us, I think I can always understand not having the additional visitors, like in addition to parents, basically, at this point in time, just the sheer number of people that would have put in the NICU. And I remember having similar conversations at different times, obviously, with some of our nurses about just like how busy it must be. I couldn't fathom it, actually, because this, Amelia is our firstborn and also the only NICU experience therefore we've had, but I couldn't fathom what it looked like therefore to have so many more people in the NICU. But for both parents not to be in there sometimes was a little, I think that was probably obviously the most frustrating, but also knowing that when we were coming home, we weren't isolating from each other. So we were still around each other. So if something was going to happen, like thank goodness it never did. And we like COVID was not an additional problem for us, but we were still around each other. So that almost felt somewhat like a moot point in terms of us not getting to a chance to be there together. So I'll add that.
Yeah. And my last point I would say to this whole entire question would be, it's already an overwhelming situation in general, and adjusting to the new dynamic and our new normal overall is always really, really hard for any family, I would think. But the environment was rapidly changing. Every week it felt like, every day it felt like there was a new rule, because we were on the very front end of all this stuff, where one day you would walk in and there was more plexiglass, and the next day you'd walk in, you got to have a mask on. The next day you'd walk in, it's only one parent can be in the waiting room, the other one can be in. The next day it was no, only one parent at all. It just was really confusing and chaotic and hectic, and that was hard to get readjusted every single time to the new normal. So that's my last comment, I guess, on that.
Yeah. So common sense and communication are two, it's kind of part of the base of medicine, right? Making sure that the rules are understandable, and that you understand why people are coming to them. Whitney, you were nodding. Did you have any perspectives on that?
Yeah, I also February 26th again. So the next week Duke shut down. Well, the first part of shutting down. I was challenged by, again, the lack of just communication with, people in the lobby who are letting you in, and the NICU. So, I'm showing up, oh, your name is on this list, COVID, you can't come in, but I have this pack of milk. It was just, there wasn't very good communication from top to bottom. But then even in entering the NICU, I think the interesting thing for me was to see even the lack of communication between providers. And so, but I will say my heart went out to non-English speakers. And mostly because I personally witnessed 2 non-English speaking families without a translator, like their spouse, significant other, partner, sister, who was not allowed to come up. One woman just crying because she could not understand. And then to find a translator seemed to take hours. So I saw people basically use Google Translate to try to communicate about their children. So I, those are moments for me that I thought, wow, I am fortunate. I can even I just walk in, I sit, nurse comes and we can converse. Whereas this person it just had this baby and her spouse can't come in and there's no one to translate, and not Spanish or something that maybe you would think be more easily, accessible. Ooh, it was a wasp. But anyway, I would just say like that was the most heartbreaking thing for me, and watching just the lack of communication and the hospital kind of try to figure out in the moment.
Mm-hmm. So you that brings up this idea that maybe in some situations you might want to make exceptions to the policies or protocols that we put into place. How I know that all three of our providers actually have done work around the issue of bias in medicine or commented on it. How do we make exceptions to make sure that we support the sort of people's experiences that Whitney was talking about, while at the same time not introducing bias into how we see our patients? Does anyone have any comments about that?
I think that's
Diana?
yeah, sure. I think that's a really great question because, certainly, like, for instance, in the story that I told, I really tried to get that sibling to come into the ICU to meet her brother, and in the end only managed sort of a video call, but I was very much trying to, quote, make an exception and work around the policy because I really wanted to do this. And so I definitely recognize that there are so many both implicit and explicit biases that shape healthcare and shape medicine, and how those biases play into decisions about who to sort of go to bat for or fight for exceptions for can really have kind of important implications that we need to think about. And so I really appreciate that question. I think, and I don't know whether this answers the question entirely, but one of the things that I'm learning today, listening to our family speak, and especially listening to Avanti and Whitney, is this concept of the parents as part of the healthcare team and part of the, and as opposed to being visitors or being kind of on the outside looking in. Because that narrative for me, like, changes my frame of reference of what a policy is meant to do in terms of, the balance between keeping our patients and our providers safe during the pandemic and optimizing the health of our patients as well. And so this idea of thinking of the family as part of the medical team, I wouldn't think to restrict the number of RTs, respiratory therapists, that I need at the bedside. So thinking of parents or caregivers in the same way then makes me feel like the policies necessarily have to be different when a patient's health depends on those caregivers. And perhaps that for me is something, it's definitely something I'll take forward, and perhaps a way to think about policies in a way that makes it seem like an exception for the NICU or for pediatrics, but in a way that makes more sense systematically for all of our babies and kids.
Yeah, and I would echo that sentiment where I think if you center the family in the NICU, really center the family in the care of the baby and the development of the baby, and they are an essential team member, it is really their opinion and their wishes that matter. And there is, certainly from structural level, systems levels, policies and practices that we need to bend in certain situations, clearly biases that are introduced. I think on the other side is there are certainly some families and some patients that will feel more empowered than others to advocate, and recognizing the variability in how empowered families feel to speak for their baby, I think is a really important understanding that providers need to have. So going back to my story about my father, in the Korean American culture, as I mentioned, the physician's word is God, and you don't question it. If there is a recommendation that's made, that is what you go along with. And so imagining my parents kind of pushing back at that surgeon and saying, maybe now in the time of COVID is not the time for this surgery, right? So that would never happen with my parents. And so the recognition that families have different degrees of empowerment and ability to advocate for their baby, I think is a really critical piece of this conversation.
Liz, did you have another comment?
My two colleagues have said that so beautifully. I think just to, I guess, reiterate in some ways, but also put a different perspective. We learn from quality improvement, like consistency is key. And so we always want to have consistent guidelines. We want to follow those. But the truth is, like our kindergartners are now learning, it's not the golden rule, it's the platinum rule, which isn't that the same thing is good for everyone. It's what is good for that particular person, and to reflect that and that particular family and that particular patient. But that takes us out of sort of everything we've taught ourselves about consistency. So it's, I think, finding that balance between flexibility and consistency so that we can minimize bias as much as possible.
Mhm.
Can I just add, because I love that Liz brought up the quality improvement angle and frame, is that as we, maybe because I'm very data driven, but as we roll out policies, one thing that I think is very much on us as a healthcare system and those who work within it is to look for the effects of the policies in a really granular way to see how policies are impacting families of different backgrounds, to make sure that our policies are having the intended effect and that we haven't just rolled out a policy with a presumably logical hypothesis, but it's not having the intended effect and having potentially adverse implications. But if we don't look for that data and try to measure it, then we won't know.
Personalized medicine, as they say, no stories without data, and no data without stories, or you get lost. Thank you. Jan, you had a question earlier on. Let's come back to you.
Yeah, it was more of a comment that I just wanted to bring our attention to for us to consider. And Chris and Felicia, feel free to, if you want to share or talk about what this was like. But for families that lose their babies during this pandemic, not only are they, going through something extremely traumatic and devastating, but then they're also not able to bring their loved ones together with maybe even their baby's nurses or care team members for any type of service or life celebration, or when you come together to mourn that loss. So I just wanted to acknowledge how traumatic that is for the families who have lost their babies. And Chris and Felicia, my heart breaks and aches for you and goes out to you. And I just didn't know if you wanted to mention what that was like.
Yeah, that was actually that was a pretty complicated situation for us. I have Felicia's from Texas. We're in Indiana. She's originally from San Antonio, and so her family wasn't here with us, but my family was here locally here in Indianapolis. And when it did kind of come to those final days where we thought something bad might happen and the outcome might be a bad outcome, we had gotten really close to our care teams, and that was something that we really valued of our time there, and they did advocate for us to I think it was Diana talking about that. They wanted to do everything they could to help us, and the rules at that time were only one person in the NICU, and so they thank God they let us both be in there. But at one point in time when it got kind of really dicey, they told us, go call your parents, like get them here. And we called them, the whole family came, and then they stopped them in the lobby, and they had to, hang out in the lobby the whole time. They wouldn't let them in. So that was just a disconnect between the provider and the administration, and they profusely apologized, but it just kind of was what it was. But sorry about our dog. But yeah, that wasn't fun.
So she's been quiet like the whole time, and now it's just now we're done.
I'll go get her.
And I would say, I know Diana, I think you mentioned this, but the most we were able to do was actually have our family FaceTime to say goodbye to Amelia. So I think to your point, like that is one of the hardest things. I mean, she's our firstborn, and I know for my mom, she was her first granddaughter, her first grandchild. So not having family be able to really be there with us physically for the hardest moments was definitely very challenging. And then to your point, even afterwards, having a service for Amelia in the middle of all this meant, how do you ask people, only certain people, to be there for your baby, to honor your baby's memory. So that was definitely a very unique experience as well. And like you said, like we had with our care team, there's so much, like so many wonderful, wonderful people on our care team who we really wanted to be a part of, and who we would have loved to have been able to invite them to Amelia's service as well. And they were able to join us virtually for the most part, but just all of those wonderful people who really became part of our family.
Sorry, I was muted. I'm so sorry to hear about that experience. How could we have done better? Or,
yeah, I don't know. I mean, everybody was going through stuff. It was stuff that nobody knew the answers to. So I mean, we understood that. It was just, I think, I don't, yeah, I don't know the answer to that. Actually, I don't even know that I could even, figure out.
Yeah, I have a suggestion. I mean, I think there's not much that we can do to make it a lot better, but I think one thing that we could do to make it a little bit better for families who lose their babies is for providers and the care team to send cards, like handwritten notes, and cards are really meaningful. And it doesn't, even if it's a month after, even on the anniversaries of the baby's loss, I think those are really meaningful to hear that the care team is still thinking, of their child and remembering and mourning and grieving with the parents. I think is really something that we can do during the pandemic.
I'll agree. I mean, just because I can say, speaking from that experience, every time we've been blessed with those relationships that we have, and every time we have received something, whether it's communication via like online, via Facebook, or the neonatologist who cared primarily for Amelia sent us a book that he had wanted to give us while we were in the NICU, in this beautiful letter. I know for me, just sent me into tears, but the beautiful tears of grief, I guess, because I knew that they were thinking about her and us.
mm-hmm. There's so much additional challenge and so much pain in a NICU stay at any time, and obviously it's been much more in the past 8 months. I'm just going to ask, can any good come of this, just to turn this around in a different direction, and say, did we learn any lessons in either in how we interact with people in pain, or about how we write guidelines, how we run a NICU? Do we just put this behind us and kind of move on, or do we take something with us? Any thoughts from the providers?
I guess, I think there's a lot of fear that this experience can negatively affect patient and family integrated care, and is obviously damaging our ability to integrate families. But I also think we can flip it on its head and say this is reinforcing just how critical and essential patients and families are, and parents are, to the care team. And so I hope that what we can take away is that we need to really prioritize integrating parents as part of that essential care, critical core care team.
A reminder, Liz.
I agree, and I think I think about what Diana said, and there's nothing that really replaces touch or physical presence, and yet how we communicate has just completely changed 180. And if we can include now, extended family or other people by Zoom, we're having so many family meetings by Zoom, and that just opens up the potential for touching people who aren't nearby. And I will say, for some of our units who don't have a video system like NICView or others, from what I hear, there's been a big run on those kinds of cameras. And so if we can continue to maximize the touch points for digital connection while hopefully regaining the in-person connection, I think that will be an improvement.
Yeah. Awanti, you were advocating for change. I mean, what would you take along in the post-COVID era that will come?
I don't know. So to be honest, I never really planned to be advocating at that time. I just was advocating by circumstance. I didn't want to be writing emails. I didn't want to be doing any of that. I just wanted to be with my family. And
Fair enough.
but I do realize that speaking up helps. I don't know how to answer your question, but just in line with focusing on the emphasis of touch, one of our friends gifted us these Zaki hugs. I think they're made for premature babies in the NICU. Like you kind of rub them on you and then put it in the baby's isolate when you're away. So they can smell you, or just have a comforting touch, or just any item of yours there that supposedly helps. But
Yeah.
I don't know, like
Okay.
I'm very, I can just say that I'm so happy that the hospital I was at did listen to families and did integrate over time. And even now with really harsh restrictions, now they've just completely stopped visitors in the adult hospital. They're still continuing, allowing 2 primary caregivers in the pediatric and NICU facility. And to me, I think that's the best thing they could do. And that's the best thing. I don't think anything else is a substitute for that presence.
That's great.
And also parents, yeah, I mean, parents take as much, if not more care, of hygiene and masks and touch, because it is their baby. I would argue even more than the medical team, so I do feel like there has to be a little amount of trust that the parent is not in fact bringing more risk, but rather, is being possibly more careful than all other nurses and doctors too, because while the medical team is amazing and they take care of your baby as there's ultimately it is the parent's child, so nobody would take care of them more. So I do think these factors, these conversations should be had.
Very, very good point. Very good point. Wait, so just to maybe finish up, we have a question here about really the core, I guess, of what we're doing. We've been talking about quite a bit about how COVID has affected the relationships that we have amongst the 3 of us, the patients and their families and the providers. The question is, how has the overall quality of clinical care been altered by COVID risks in the NICU? Do we have any measurement of that? Do we have any signal that the other aspects of what we're doing in the NICU have been impacted by the changes we've made for COVID?
Yeah, I'd love to weigh in on that. And, while I can't cite a large study, I think for many units, at least in here in the Rocky Mountain region, we've come to realize just how important all the members of our NICU care team are. And with COVID, they have not been able to be present physically in the NICU. And so even during rounds now, our pharmacists, our dietitians, our case workers, our social workers have had to join remotely or not even be available at all. And I think that definitely has impacted the quality of care that we're giving to our babies. And while the attending physician might make some medical decisions, I think we all recognize that it's all these other team members that, in some lead to the best type of care for the baby. It's multidisciplinary and everyone's looking at different parts of the baby and the family. And we haven't had that, I think, during COVID as much as we should. I think I'll just give one example also is for our opioid exposed newborn population, where family presence is essential, but so are things like the Cuddler program, so are good, social worker supports and case management, and really trying to optimize that transition of care. And that hasn't been as possible during COVID, like I said, because of the restrictions and the number of people that we can have in the unit.
Jen, I know that you and I did a podcast a few months ago, and you brought up a couple of issues around that time, that even in the early era of COVID that you were seeing. Did you want to chime in about about donor milk?
Yeah, I mean, yeah, absolutely. And just how some infants, I think it varied by centers, and Liz and others feel free to jump in, but I know some, there was a lot of concern whether the ability for mothers to provide their milk would be impacted, and then the supply of donor milk and getting that donor milk, and then the potential risks of donor milk. I know that was a question initially, whether there was any risk of transmission of COVID through donor milk. And so, yeah, the families that have shared their stories and how difficult, and I know Whitney, you mentioned how difficult it was and challenging to be able to make sure that your milk was getting to your baby in a timely manner. So, yeah, absolutely.
Thank you. Well, I think unfortunately we've come to the end of our time, so I'll turn it over to you, Jen.
Great. Well, thanks. Yeah, thank you for facilitating the discussion, John. We really appreciate having you. And to all of our families and providers, thank you so much for being here and for sharing your stories. Jonathan, thanks for making sure we stayed on track and on time. And thank you all so much for joining us. Stay tuned. We will be announcing our 2021 webinars in virtual sessions soon. So thank you so much, and we'll be in touch.
Thank you, everybody.